I don't know if we're live on the TV. That's what I don't understand. Well, we'll get started. Hi, Jeannie.
Sorry I'm late. I mean, I was here, but
You were here. I saw you earlier.
don't ever stop and talk to me. Work here in the building.
So welcome, everybody. Appreciate you coming here. This is nice that we're back in person. We've tried to do this remotely for a year, and it was not a huge success by any means. Was a little disappointing, but it was just hard. I mean, with COVID, it's just everybody was making up the new rules and trying to figure out how to live with them. So I just wanted to thank you for coming in here. And we will do a quick staff update after we do some introductions, and then we will be needing to elect officers. This is really kind of a reorganization meeting. We have 3 new members that have joined our group. I don't know if they're all present today, but we have 3 people who are joining the ADRC advisory. We also have a few more openings. And we are recruiting some individuals. We've got some asks out. We still have one more slot that we could use, maybe if you have any recommendations of somebody you could reach out to get it. We will talk, though, we have to have members that represent certain populations in the community based on the resolution from the county board. So, so this is exciting to see all of you, and to start the introductions, I'm Deb Sukla. I'm the Human Services Director. You won't see me at most meetings because typically the ADRC Director runs the meetings, but our ADRC Director is on her 2nd week in this job, so I decided to assist her. And we are just really delighted to have Melissa join us.
Yeah, so, yes, just started last Monday, so pretty much brand new to the position. So just really looking forward to working with you all and looking forward to leading the ADRC. So it's really an exciting opportunity. So it's something that I do have quite a bit of experience working with the aging population and disabled population. So kind of going back to where I started, that's where I first started working in social work. And so I'm kind of come around full circle. So I'm glad to be back. Excited to work with you all. Thank you.
And I want to mention Melissa Youngbauer. She's been with Human Services, so she looks familiar. She's been in our department for 4 years working as a social worker in behavioral health. Prior to that, she had worked elsewhere in the county, as she said, with aging populations. So it's very exciting to have her, and it's exciting to have somebody that I have such great respect for to work side by side with us in the ADRC. So Tammy, you want to introduce yourself, and then we can go around the room.
I'm Tammy Munson. I am the ADRC admin across the street. So Hannah and I work close together, so I'm excited that Melissa and I are going to start our new venture. Hopefully we make some great strides in getting this back on track.
Can I just bring up something? Do you want us to be using the mics? I noticed that Melissa's is muted. You see the red around the microphone. That means it's not working. So
You only use it when you're talking, otherwise the
Yep.
people out in the community, they hear your papers shuffling.
Yeah. So we do ask that you just press it so that the red button comes on, and then it should be working. And then the people that are watching can also, and the reason we're having this televised is because it is, again, with COVID, it has been more difficult for the public to come into the building and participate in our public meetings. And so by open meeting law, we are televising our meetings, so that is a way the public can connect with us.
just push it once. So is it green for on and?
Red for on.
Red for on. There's a little blue button it'll be like blue and red when you first press it, and then the red will just stay on.
I'm sorry, I thought it was the other way around.
I already have it
No,
on.
thanks for pointing that out.
And I
So,
just learned last week that the 2 of you should leave your mics on all the time,
Oh,
or the people out in the public can't hear.
well,
Otherwise, the rest of us, only when we're speaking, we should have it red.
thank you.
Good
Well,
to
I don't
know.
sit up here very
Yes.
often, so thank
Well,
you.
How do you get it off from red?
You just
Press it again.
This button here?
Yep,
The left of it? Oh, down here. Oh, there we go.
okay. Yep.
Oh, I'm Ruth Gallixrud from Strum.
Okay.
I'm new.
Yeah, and she's a new member, so congratulations for joining us. Thank you.
thank you.
Way over to the left.
Scott?
And that'll take you
I'm Scott Brown from the Whitehall area. I've been on the board for 3-4 years.
Mary?
I'm Mary Beck. I'm from Whitehall.
Thank you.
I'm Dora Jean Blaha. I'm from Independence.
I'm Nancy Havel. I'm from Gilsville.
Linda Schaefer from Whitehall.
Beth Killian, County Board Supervisor number 7, representing the county board.
I'm Jeannie Nutter. I'm on the county board and I represent District 15.
And I see Mary, are you online? If you can hear us, you can introduce yourself.
I'm Mary Frisch, and I'm from Arcadia, and I am new to the board.
Yes, thank you for joining us. We also have one other new member, Sherry Haynes, who is not here today yet. So this meeting is going to be a bit of a reorganization meeting. We're going to get a little bit into that. We actually, we sent out some bylaws to you that are grossly outdated. After I was reading the resolution last night that merged the ADRC and aging, I realized how outdated the bylaws were, so we'll be talking about that in a little bit. We do have capacity for 14 members on our committee. Did you hand out a document like this?
I did not print that one out.
Okay. So we need to have 8 members representing individuals over the age of 60, and at this point, we have Dora Jean Blaha, Scott Brown, Linda Schaefer, Ruth Gullicksrud, Mary Frisch, and Sherry Haynes, which leaves 2 vacancies. We need 2 members representing individuals with developmental disability. We have Mary Beck, and we have an opening. We have 2 members representing individuals with physical disability, and that's Jackie Hogan with another opening. The Human Services Board member is Jeannie Nutter, and the County Board member is Beth Killian. I believe Randy Herman is also part of this group. Nancy, were you going to continue on this group as a representative for the those over 60? Because I didn't have you on my list, but I know you've been very involved before, and I'd love to have you continue.
Yeah, I kind of like, I'm sorry. I kind of like representation from our area, the county and south.
Okay.
And it's really difficult for me to get up and get going and to get here on time. So I would just as soon not serve.
But you'd like some representation, though, from the southern part of the county is
Yeah.
what you're looking for. Okay. Maybe if you know of anybody that you could forward us some names that we could reach out to, that would be really helpful.
I've been trying.
Okay. If all else fails, I'll have to get my mom from Adrc, but I don't think she'll love that.
Oh,
Lois Deeren, Clemic Deeren.
oh, okay.
Um,
I will talk to her.
We also have Randy Herman, and he could represent either individuals with developmental disabilities or individuals with physical disabilities. I am reaching out to another person who could represent individuals over age 60 and a person who is a guardian of a young adult with a physical and developmental disability. So I think we'll wait and see once where we put Randy based on where this other candidate comes in. So at this point, we have 11 members and we could have 14, but we hopefully by next month we'll have this all filled, or the next meeting, which will be in June. Because you meet every other month.
Yeah.
So we're hoping that we can have a full roster at that point. So this is a little bit of a rebuilding and regrouping. And to be honest with you, we thought the bylaws were governing us, and when I was rereading them, I'm like, this doesn't make any sense. Then I looked up the resolution, which I handed out a copy to all of you, which is really what governs us at this point. And again, we'll walk through those shortly. But I just want to tell you who the members are. So for staff updates, our biggest update, of course, is we have an ADRC services supervisor. Anna left us to go back to family care in January. And so Melissa is able to join us. She's still doing a little bit of finishing up her old job, but she is really balancing the new job and the old job beautifully in a way I don't know how you're doing it, but thank God you are. So I appreciate that. And are there any other staff updates that you have, Melissa?
Hillary.
Oh, yes. Our dementia care specialist has resigned as well this past month. And so we do have our dementia care specialist position is open, and we're hoping to be hiring that position soon. So thank you. Good
Yeah.
point.
Yeah.
I'm so excited you're here. I forgot about everything else.
Yes, looking forward, already seeing, yes, what a loss not having somebody in that position is. So looking forward to getting that filled as soon as possible, because they can do a lot of good work that's needed, so.
So at this point, the chair we had in the past is Jackie Hogan. She isn't here today. I haven't seen her at a couple meetings now, but again, last year was difficult for people to join. And so we just, following the resolution and following, although the bylaws don't pertain, we should have elections at least every other year for officers. And so I would be looking for someone who would be willing to serve in the capacity of chair. The duties of the chairperson are to facilitate the meeting with the help of Melissa and to prepare the agenda with the help of Melissa. Basically, Melissa will do most of the agenda. You would approve the agenda. And then there'll be a vice chair position that would fill in should you be unable to attend a meeting. So if anybody'd want to serve in that capacity, that would be wonderful. Any volunteers? Scott Brown?
I was waiting for other hands to go up, but I would be willing to serve in that position, especially hearing others say yes.
Georgina, are you making a motion to nominate Scott?
Yes.
And I'll second.
And Jeannie seconds it? Okay, officially, we have to say this 3 times. Are there any other nominations? Are there any other nominations? Are there any other nominations? Dora, are you making a motion to close the nominations and put in a ballot for, unanimous ballot for Scott Brown?
Yes, I will do just what you said.
We need a second to that?
I'll second.
Thank you, Jeannie. All those in favor of the motion signify by saying aye.
Aye.
Those opposed? Congratulations, Scott.
Thank you.
Yeah.
You can certainly run the rest of the meeting, or you can have one of us do it. It's up to you, however you'd like to do. I can certainly step over to the side if you want to move up here.
I can.
Okay. I'll sit at that little side table over there.
Oh, I could do that too. Should I do that? I can do that.
Okay.
Yeah.
We'll have you sit right over here, Scott.
Yeah.
Melissa's not ready to be up here by herself.
I had requested that Deb really take the lead on this until I kind of get to know
Thank you.
all of you a little bit better in my role, so I appreciate that.
Well, you've had like a week and a day, Melissa. I mean, come on.
That's more than most people get.
So we'll need nominations for a vice chair.
Okay. First of all, thank you very much for your support. We'll try to uphold the duties of the office. I have a lot of other positions where I'm leading, and so trying to juggle those has been a challenge this year, but this group meets only about 4 times a year.
About every other month, yeah.
Yeah, every other month, so that'd be 6 times.
Yeah.
To do the math right, so thank you. All right, entertain nomination for vice chair.
Any volunteers? Mary, if you're interested, you can speak up too.
Thank you. But since I'm new to this, I think I'll pass at this time.
Okay.
We could probably nominate somebody that's not here too, right?
Yeah, that'll teach you to
That often happens.
Is anybody willing to fill in at least temporarily?
Killian would like to nominate Dora Jean.
I'll second that.
Any other nominations for vice chair?
You have to say it 3 times.
Any other nominations for vice chair? Hearing none, I'd entertain a motion to approve Dora Jean as our vice chair.
Killian would make the motion to close nominations and appoint Dora Jean Blaha as vice chair.
And Jeannie Nutter will second that.
Okay, it's been moved and seconded that Dora Jean be our vice chair. All in favor signify by saying aye.
Aye.
Opposed, nay.
Aye.
Motion carried. Thank you. Congratulations, Dora Jean.
Thank you for having confidence in me.
Thank you. The secretary position, of course, we won't need for this group because Tamara takes care of all of that for you. So that is we appreciate the work that she does for this committee. In fact, she's the only one who has any history of the leadership here of what this group's been up to. So we've really leaned on Tammy for a lot of help with this. So thank you, Tammy. So the next item, Mr. Chair, if you don't mind, we'll just keep moving along.
That's
Number
great.
5.
That's great.
So the ADRC advisory roles and responsibilities, because we have some new members, because this is a bit of a reorganization meeting, we wanted to share with you some materials about how we organize ourselves. We wanted to get your input on that. And did they all receive this packet?
Yes, they did.
So in your mailing, you received a packet called Board Orientation Guide, which is really well done. And I think it really outlines what the ADRC new board members really need to focus on. The first part talks about the mission, the purpose of the ADRCs. Again, Wisconsin played a very unique role in creating the ADRCs, Aging and Disability Resource Centers in the nation. We are to help older adults, people with physical or developmental disabilities. Excuse me. Sorry. Allergies. Really live as independently and with as much quality of life as possible. And so we want to empower individuals to find the services and supports they need to do that. On page 4 talks a little bit about the history of the ADRCs. You can read that when you have a chance. But starting on page 5, there's, in the gray part of it, it talks about the board member roles. And I'm not going to go into detail on this because you can read this at your own leisure. But the main roles of the board members is to reach out to the community. We need you to help spread the word about the ADRC and let people know what's going on with the ADRCs. On page 6, we need you to represent the ADRC customers, again, the population I mentioned earlier, those over age 60, those with developmental disabilities, and those with physical disabilities. And so we need you to bring their voice back to the county and help us know what's going on and how can we continue to improve our operations. On page 7, it talks about quality improvement, and as we get going, we will be bringing you reports about the services we're doing, and part of your job is to help us continue to look at how do we do quality improvement. One of the things the ADRC has to do every year is to have at least one quality improvement project every year. And so you may be helping get the word out about those, things like that. And then page 8 is analyzing and raising awareness about unmet needs. Instead of just talking about what do, we also need your voice to help us hear what needs are in the community that are unmet, that people could use some additional help on, that we aren't doing a good job on. And of course, page 9 says that you will work with ADRC management and staff, which is what this group does very well. I think this group has had a beautiful history of working really well with the ADRC staff and vice versa. So that's kind of your big responsibilities. As far as how we are organized, I would direct you to the resolution, and I apologize, Mary, we will, I'll have Tammy scan. Did you get a copy of this? No. After the meeting, Mary, I'll have Tammy scan a copy of this resolution and send it off to you. But
That'll be fine. Thank you.
Thank you. So in 2009 or 10, I wasn't here at the time, aging was its own department. The ADRC was run with human services in the human services department, but aging was its own department. Around 2009 or 10, aging merged into the human services department. But aging and ADRC still ran separately. Those were different units inside of human services. And initially, for one of the reasons is the aging funds have to be kept in separate funds. There's all kinds of rules around aging programs, and there's all kinds of rules around ADRC, and so it made sense to keep them separate. But in late 2013, shortly after I started, Kathy Gauger and the staff did a study and determined it made sense to put them together. Kathy was supervising both areas. It made sense to put them together. And so we had separate governing bodies, and now we needed in 2013 to create one governing body, which is all of you. And that's what this resolution is talking about. And the reason I give you that is not to read all the mumbo-jumbo legalese stuff, but I think it's on the back page about what's resolved. And the ADRC Aging and Disability Resource Center and the Trempealeau County Senior Services will be merged into one unit known as the ADRC unit. So even though we say you're the ADRC committee, you also serve as the voice for the aging in the community as well. And it's also resolved that the Long-Term Care Committee, which is the bylaws that you received in the mail, and Senior Services Committee be dissolved and a new ADRC Advisory Committee be created, comprised of 8 people who are age 60 and older, 2 people who have physical disability, 2 with developmental disability, 1 Human Services Board member, and 1 County Board Supervisor. And so when I talked earlier about that membership, that's where that came from. So I just want to give you this so that you understand how this body's been created. What I have figured out is that when we did all this, we never went back to the bylaws from the old body that was dissolved, and we never created bylaws for this group on how do we elect officers, how long are people's terms, things like that. If that's something this body would like us to do, certainly Melissa and I can work with the Corporation Counsel, our attorney for the county, and bring back a draft set of bylaws for you. I think that would provide some additional structure on how you govern, how long the terms are, how you elect officers, when meetings are held, all those kinds of things, if that's something that you would like. You call on.
Yes,
Jeannie.
Jeannie, yep.
I think it would be a good idea, and I'm not sure we need to reinvent the wheel. There's probably lots of ADRCs that have some current bylaws that we could look at, and I don't think it would be too big of a deal. But I'd be glad to help if you would like me to, especially if we do it this summer, because my life will be good this summer when school's over.
Good.
But I think it would give direction, so.
Okay. So that'll be a project for us to work on. Maybe that could be our quality improvement project, if the state will allow us to do that, is to create those bylaws, because that is a piece that's been missing, and that's how you ended up with bylaws that didn't make any sense.
I have a request. I don't want to quit now.
We can put you back on.
At
Too
least
late.
until somebody from our area will accept, and can I keep trying to get somebody down there?
You bet. You can, we will keep you on. You were on before, so we'll keep you on. And then if you at some point find somebody else, then at that point you can resign and we can appoint them.
Okay, thank you.
Thank you.
Can't she stay on anyway?
Yeah, she can stay on.
Yeah, there's no need to go, even if you find somebody new.
As it gets more exciting,
Right, I was gonna say, you don't wanna leave.
Find somebody new.
It's exciting. It's gonna be too much fun.
Right.
yep.
What
Mary.
is the amount of,
I want to thank everybody for having me coming back. They call me and ask me if I want to come back to here, and I said yes.
I'm glad you did.
I like it.
Yep, we're glad you're here, Mary.
It's fun, it's excited.
Yes, it's a good, and we appreciate having you at the table.
Thank you.
Dora Jean?
how many people are we supposed to have on the board? Is it 15?
14.
14.
There's 14 is 8 individuals representing age 60 and over, 2 representing people with developmental disabilities, 2 members representing people with physical disabilities, a Human Services Board member, and a County Board member. So we are missing, with Nancy staying on, then we would still need 1 representative for the over age 60, a representative for developmental disability, and a representative for those with physical disability. And if Randy continues to be part of that, we've got to figure out what where he belongs on where this list goes, so that could change some of that. Again, we are reaching out to an individual who is over 60, and we're also reaching out to an individual who's a guardian of someone who has some physical and developmental disabilities. So hopefully, again, next month, we will have a full roster, and you'll have all your members.
Did Richard's staff resign?
Have you considered changing the time at all? Since,
That is this group's discretion when you have your next meetings. Right now, the schedule is that you are every other month on the second Tuesday at 10 a.m. But if this group wants to set a different schedule, that is fully within your right to do that.
If it's too early for some of the members, is what I'm thinking.
Sure. I mean, if you want to move it back to 11 or a different day of the week, if you want to meet more frequently, that is really the prerogative of this group. That is not what staff direct. That is really what this group, I mean, we can provide some recommendations, but this group is really, you're the decision makers on that.
I was going to say, I do know Randy reached out to me. He is going to stay on. He just had, he was off today, and he was going to try to phone in.
Okay.
But he didn't get it to work, because I told him Jeannie called from a parking lot one day. So I told him that it
the
works.
festival parking lot, but I could see you guys. I used the WebEx link on my phone, or Zoom, whatever we have.
So we got to figure out which, I think Randy can represent a few different areas because he works with a nursing home, he works with people with different disabilities, so he can kind of fill in where we need him to fill in, I think is kind of the nice piece of that. So that's all that we have, unless, Melissa, do you have anything else on the roles and responsibilities? Again, we just kind of wanted to kind of step back to square one, let you know what your job is, how you're organized, and how you're proceeding. So that's all that we had.
Thank you, Deb, for explaining all that. It's quite detailed, and we appreciate all of you that are willing to continue. Our next item, discuss resuming in-person services, local transportation, congregate meals, prevention programs, and memory cafes.
Melissa, do you want to start out with some numbers about the COVID? You'll have to get a microphone.
Should I go?
Yep.
It just seems odd that I'm speaking and I'm just not used to
I don't know if
this.
you can move these. Others ought to had you move it, but I don't know if you can.
They're kind of heavy and you have
Yeah.
to be careful.
That's fine. No, on 4/11, so I believe that was Sunday, the state of Wisconsin released new data
Can you
regarding.
put the microphone closer to you? Sorry.
Yep. So on 4/11, which would have been Sunday, the state of Wisconsin released new numbers for vaccinations for the state and for specific to each county. And when looking at the data, so in Trempealeau County, I was really impressed with the numbers. So looking at 65 plus, 85.3% of our residents have completed the entire vaccine series.
That are over 65.
Yeah, 65 plus, 85.3% have completed. And at least one dose, 91.8% of our county ages 65 plus have received one dose.
And how does that compare with the state? Do you have other information or how?
I can
county
grab
does?
that.
Yeah.
We're far above the state levels, which is great. And actually, we're a little bit above our neighboring counties as well. So that's good. La Crosse is a little bit above us. But overall, I feel, I was surprised at those numbers. So that's great news.
So we've, go ahead.
No, I just was going to say that I think Trempealeau County is setting standards, it seems, and it's wonderful that we're as far as we are. So thank you for presenting that.
Definitely, I've noticed when I did look at the data, the younger population in our county is a little bit lower than some of the other counties, but the aging population is really strong. So
Is the county allowing 16 and up now? Or
Yes.
12 and up?
Mhm.
Or
16 and up.
I think that started Monday.
Do we know, are the school districts going to be vaccinating in the schools? Do we know? Has anybody heard that?
We don't know that
Don't know that yet,
information.
okay.
Yeah,
Yes.
but,
I do know that all of the teaching staff or school staff have been vaccinated because that was done at our last health committee meeting. But I don't know about children or what's happening there. We do have a department meeting tonight, so I can ask that and get back to someone.
Our health department has done a beautiful job with this. I mean, they really, kudos to them for getting the number of vaccines out there. Our social workers, our volunteer drivers, our home-delivered meal drivers. We have the site in Pine Creek. They've been preparing meals for people to pick up. And those workers, they were among the very first to be eligible to get vaccines in January and February. And the health department worked really, really well with our staff to be able to give them that. So, oops. I think there's some paper towels in the hallway on that table right there, Jeannie. Jeannie, if you go the other way, there's paper towels on that table. Oh, she didn't hear me. Oh, well. So the reason we bring these numbers to you is because we have had people asking about when are the buses going to run again? When can we start getting rides for something other than medical? When will the nutrition sites reopen? And so that's what we've been getting a lot of requests about. And we want to do it in a safe way. And so we felt that knowing the number of people or the ratio of people that have had vaccines will help you with that decision. The staff are ready to proceed in whatever direction you want. The in-person services that we're talking about today would be the local transportation, which would be for things other than medical, the congregate meal sites, the prevention program that we'll be starting up sometime this year, and then the memory cafes. We've been doing those remotely, and that's been a little difficult because it's a tool to help caregivers get some support, but not doing it in person has been hard for people. So we'd like to be able to talk to you about starting these, in some type of capacity, what your general thoughts are. We're not asking you to give us a date today, but we wanted to talk to you about what are you comfortable with, what would you like to see us working on. And Melissa, did you have some materials from another county? Do you want to talk about those?
I believe everybody was given copies of the Washburn County plan. So that does outline what Washburn County is doing. I did look over that information. Their senior centers, it looks like they opened in March. So it's interesting data. It sounds like in the nation, Washburn was one of the very first to open their meals and their senior centers.
And Washburn is way, way up north, and they're a very rural county, and so I think they felt really obligated to move more quickly than some other counties because there isn't anything else around, and so I think that was part of it. So we just want to kind of open it up to you on, would you like to see us talk about opening these facilities in the next month or two? If so, what are your concerns? What are your thoughts? What are your thoughts about providing the bus service again and the local transportation services? Any recommendations on getting the word out to let the world know that we're back at that? So this is really a dialogue to hear from you.
Yes.
Could you kind of explain, since I'm new to the group, I mean, I know a little bit, but kind of how these different programs work?
Yes.
Because I do think we need to start serving people again, but I want to do it safely.
Great point. Sometimes I can't see the forest for the trees because I'm so deep into it. So prior to COVID, we had a number of congregate meal sites. We also had home delivered meals for people that couldn't get out. The congregate meal sites were really there. We had one in Osseo, we had Boondocks, we had Rainbow, we had
Cafe.
pardon?
Whitehall Cafe.
Yep, the Whitehall Cafe, the Pammy K's After 5, missing one, I think. Pine Creek. So we had a variety of those sites. And then we also had the home delivered meal program for individuals that couldn't get out in the community. We had made some changes to the home delivered meal program because we had signed people up for it. You know, sometimes if people have like hip surgery or something, you need home delivered meals for a period of time. And then you just never got off the list, and we kept bringing you meals. And we would have to like leave the meals outside people's homes because they weren't home to get them. Well, then they're not homebound if they're out and about. And so we have changed our program a little bit to do assessments more regularly on what do you need and how long do you need it, because it was getting to be costly for us to be delivering those meals to people who really were able to go out and get the meals. So that's the Congregate meal program and the home delivered meal program. There's a suggested donation for each. I think it's $4, Tammy? And that's a suggested donation. People can pay what they can afford to pay. We also deliver a number of home delivered meals that we sell to family care agencies for their members, that they're purchasing meals from us. They purchase at a much higher rate. They purchase at the actual cost of the delivery and the meal and all that kind of thing. And then we also have the bus service. We had a bus service that would go to La Crosse a day a week, Eau Claire, Winona, and Black River Falls. And then we also would use the bus service for special events like days that food pantries are open or things like that. And then we have the local transportation program. We have been using that program during COVID to help take people to doctor's appointments, either the volunteer driver program or our local transportation program. But we haven't been doing other trips just so people can get into town to go shopping, to go get groceries. We have picked up groceries for people over COVID. That's been part of our service, although that hasn't been used very much lately, I don't think.
No, but we have been taking people shopping.
Yeah. So we
Designated days.
Yeah, and so we've been doing that, but very limited. And so we'd like to be able to go back to the services that we were offering again, at least to kind of get that benchmark back, and then maybe at some point this group can determine if that's sufficient, or if you even want more service than that. That would be what this group could talk about at some future meeting. But we'd like to get back to that and offer that service. People are missing, we have a lot of volunteer drivers taking people to La Crosse for medical appointments that used to take the bus. They would schedule the bus, and they would know the bus would go to La Crosse on, I'll just make it up, Tuesdays or whatever. So they try to schedule their appointments on Tuesdays so that they could take the bus. The bus holds about
One wheelchair and 7 others,
yeah,
something like that.
7 or 8 people. So so that's a nice option for the community. So we just wanted to talk to you a little bit about those services. We have not been running the bus since COVID started. The Congregate meal sites, most of those closed. Rainbow and Pine Creek and Boondocks have offered carry-out options for people. That they can't do the home, you can't come in and do dining there, but you can go pick up, and some of them have, for some special cases, even delivered to people's homes. What we've seen, of course, was a reduction in our Congregate meal program and an increase in our home delivered meal program is what we saw. And we did get some federal funding to help with that, so that was helpful as well. Does that answer your question, Beth?
Yes.
Okay. So again, we open it back up to what are you comfortable with? What do you want to see us looking at? Any recommendations and thought? We'll do the work, but we just want direction from you.
We have to begin somewhere, and it seems like the appropriate time to begin at least researching what Trempealeau County can do. And I think the staff are in tune so much. Melissa just gave us from Sunday what the statistics are, and if we should start ending up like the state of Michigan, I imagine we'd just pull back. It's very easy to do that, but it's a little more difficult to plan, and I feel strongly that we need to begin that plan so that we can open up sometime soon. Other ideas?
I agree with you. We need to start somewhere. Are the restaurants open that we?
So the Congregate meal, yes, the restaurants have been open.
Okay.
So what's also happened in the meantime, because life goes on in spite of COVID, is our nutrition contracts are for 3 years. And so our nutrition contracts for home-delivered meals and congregate meals went out last fall for starting 1/1/21, because that's when the old contracts were expiring. And not surprisingly, a little surprising, but not maybe it's too bad, we did not have many congregate meal sites bid. We had Rainbow bid, we had Dove, although they had very poor attendance in the past, and then Rainbow, Dove, and Boondocks bid. And we continue to operate Pine Creek. But we don't have, Pammy K's didn't bid, and so there's nothing in Whitehall that bid. There was a place in Independence that had expressed interest. But these bids were due in November. And November, as you recall, was when the numbers were super high in this county. And I don't think any restaurant had any idea if they would even be in business for the next 3 years. Oh, we need more towels again.
I'm sorry.
That's okay.
We may not be able to
Tammy,
have
can you
drinks
move her
in here during meetings.
Yeah, we'll have to,
Just,
here we go.
Part of the problem is the mask. Kind of throws you off.
do you need, make sure the microphone gets dried off. That's,
The bottom of the microphone, make sure that gets straight up.
Glad it didn't go on my lap. That's
Thank you, Tammy.
it is fine. This actually did not get that wet.
No, Tammy jumped up and grabbed the microphone before it got wet.
Yeah, that I take it, we don't have, I don't have to have that. Everybody is helping me.
You just want some coffee.
First took most of it.
So at this point, for the congregate meal site, wait till everybody gets settled down again.
Say, do you have an extra one of that board orientation? For some reason, I didn't get that.
We will get you.
Yes, here, you can have that copy.
Thank you.
Yes.
So-
Thank you to the emergency response team.
Yeah,
for,
holy moly, you
jumping
guys are
just
like,
right in there.
Well, these microphones are very expensive, so you have to treat them with kid gloves.
I'm sure.
and so, again, last fall, when we put out bids, we did get the home-delivered meal sites. We have Grandview and Dove are providing the home-delivered meals that Dove for the northern part of the county, Grandview for the southern part of the county. But for the congregate meal sites, is one of the things that we would have to do is we would have to rebid, because we have so few options. And quite frankly, I think it's a different time than it was last fall. Last fall was really hard for any small restaurant to say, I will be in business for the next 3 years, and I can tell you this will be the price that I want to be locked into. Because whatever price they put in there, they're locked into that for 3 years. So with your permission, we would then go ahead and rebid for those congregate meal sites so we can perhaps get some more open. We will do some planning around opening those who have already bid. And then we'd bring those bids back to you so we can make some decisions on what sites we end up selecting. Does that answer your question? Whoever asked about if the restaurants are open?
Well, I did. The only thing that kind of is troublesome for me is Trempealeau County no longer has a mask mandate, and people aren't wearing masks in Trempealeau County in businesses. So I would worry about what happens. I mean, you go there, you take your mask off when you're eating, but there's still a lot of unanswered questions. We have the variant in this county, the one from London or Britain. So
I will just point out that in the
In this
Washburn,
document.
in their plan, it does specify that when they are not eating or drinking, that they have to have the masks. So I don't know then, if you look at the plan, it is pretty detailed. They
Right,
do-
I'm not so
yeah.
worried about I'm not so worried about Dora and me going into a restaurant. It's the other people
Yeah.
that are in the restaurant
Right.
that are not, there for nutritional lunch.
And
I mean, I'm just,
there's, again, if we select them as a site for a congregate meal program, we don't have a lot of control on that. And
Right.
quite frankly, it's, it's kind of a 6 of one, half a dozen of the other. The nice thing about having those restaurants as a congregate meal site is you can go to a restaurant and not just mingle with the people, and because the purpose of congregate meal site is to see other people, get out and socialize, which isn't always the best thing in COVID, but again, I think you can do it wisely. Oh, I thought you were going to have a question.
And
So
they-
I think
excuse me,
that,
But I have gone to a couple of them, and for the group, they usually have them in one separate area anyway, it seems. We're all seated at one table.
Some
Now,
do that.
In Independence here about a week ago, some ladies and I went in to have dinner, and both tables on either side of us, none of those women wore masks. So you never know what you're going to meet up, but sorry I interrupted
so if we
you.
have the meal sites at restaurants, again, we have some limited control on that. We could ask that there's a special back room or something set up and that tables are further apart. But again, whatever you want us to put in there, we can require. If you want us to say that people that participate in the senior nutrition program need to wear masks, we can put that in there, so.
and then you'll get, it'll be difficult. I just think people just need to be safe and think about their own health when they're going into a restaurant.
A lot of people in where I live in that don't want to wear masks. I go out in the hallway, I put my mask on because I want to be safe. But a lot of people think it's silly to wear a mask. And I think it's safe to wear a mask for all people, not just for older people, but a lot of young people too.
The process for bidding would take a little bit of time, probably months. And so
I'm sorry.
I'm thinking that we probably need to create a motion and a second, and then we can discuss it more. But we should start with a motion to continue or to start a bidding process for the congregate meals.
I'll move that, start a bidding process.
And I'll second.
Okay, Linda moves and Jeannie seconds. Further discussion, please. Yes?
Does the bid have to be for a 3-year commitment? Can that be reduced to 2-year? Because it's hard to think about what's going to happen 2 years from now, much less 3 years.
Well, logistically, it would end up being 2.5 years. I guess if we could put in there that if people want to do something different than the 2.5-year bid, they could. But the county has typically done a 3-year bid, and then we get locked into that. And then again, 3 years later, there's another bid process.
Can you repeat that motion?
The motion is that the ADRC or Trempealeau County will open the bidding process for the senior meals in the congregate meals in Trempealeau County. And it would be open then to any of the restaurants that would care to participate or want to participate in that program for a 3-year period, 2.5-year period.
And those bids are very specific. In the RFP, we're very clear on what the nutritional requirements are and all those kinds of things. So all of that is already in there. So when they bid, they know they're going to have to follow a lot of rules on how that all works. And so that's, again, it's clear to anybody that wants to bid. They can be like, that's a headache I don't want to get into, or this is a great opportunity for my company. We would then, if this is passed, we would take this to the Human Services Board in early May, and then we would release this RFP in the middle of May, and then we'd come to you in June with some proposals, hopefully.
Sounds good.
Further discussion? Call the question then. All in favor by signifying by aye.
Aye.
Opposed, nay.
Aye.
Motion carries. Thank you very much.
Any recommendations on the bus service or expanding the local transportation? The bus service has not been running. If you'd like us to start that, we could. We have looked at putting plexiglass between the seats, but that really doesn't work well on that bus. So we've looked at some options. Obviously, we'd provide hand sanitizer on the bus and all those kinds of appropriate protective things. So what's your
Have you
thoughts on
thought
starting
about
the bus?
reducing the,
Oh,
have you thought about reducing the number of people?
We
that
could
you
do
would
that
be
as well.
Providing service to?
sure, we hadn't thought about that, but we could certainly do that if that's a recommendation of this group.
How many?
Like instead of 8, 4, or something like that.
How many fit on the bus? I forget.
8.
8? Okay. Is it usually full for rides? Yeah.
Is this the bus that has the wheelchairs on it also? There's 2 wheelchairs?
Yes.
It seems like it is dependent upon what the event is, whether it's full or not.
Right.
There were times that the bus was going up to Dove for the meal, and Mary might have been the only person at the time. So it just, and I imagine the shopping trips are probably a lot more full. I'm just,
Yes.
yeah.
I also go to I also go to down to RCU and the Quick Trip and the dollar store in the van.
Yep, that's the local transportation.
Can we
yeah.
still do that? 'Cause
We
I
could be-
like that.
Yeah, we can be opening that up a little bit more too. Again, that's what we're asking this group about. What are you comfortable with us putting together? Where do you want us to start? What kind of protections do you want us to put in place? Again, we will do whatever you ask us to do. We just need some direction from you on where you want us to start.
Because I like going to the RCU and the Quick Trip and the dollar store because it's kind of an outing for me on Tuesdays, so.
And the individuals that would take advantage of it need to make a personal decision at that point too. You know, they are going to understand that there'll be others on the bus, hopefully the mask mandate for quite a while. But then we also, you know, a lot of those folks, I suppose, are over 60 and, you know, our vaccination shows that we're really high there. So there'll be a level of protection. So again, we have to start somewhere in opening up and I think it would be wonderful if we could do that, to start getting that service back. A lot of people don't have transportation.
I think it's a good idea. I don't think we need to look at cutting it in half, the number of people on the bus. I think if you wear your mask and you just, you know, everybody's probably vaccinated, that's gonna be on the bus anyway, so.
Just limit the amount of singing that goes on. I
Yeah,
guess
no
that-
singing, no singing on the bus.
Yep.
Yeah, I think, so what I'm hearing from you is for the transportation, that we could look at getting that going again, once we
Yes.
can get it scheduled. People would be required to wear masks in spite of I mean, that's our rule, we can require that. And that people would be riding the bus, you know, you have to make the decision if you're comfortable riding the bus, and
Right.
we can't guarantee anything.
I would like to know, what are the drivers expected to do? Do they insist that anybody entering the bus wear a mask?
If that's what we create as our rule, that's what they'll have to do.
Okay.
And they have all been vaccinated as well. The drivers have all been
okay.
vaccinated as well.
As soon as I got my shot, I still wear my mask because I want to be safe.
Do we need a motion?
Do we need a
for
motion? Because Killian would make a
Okay.
motion to resume bus services.
And Nutter will second.
that? Okay.
Do you have a timeline, or do you just, when we can get it
When you can
reasonable?
get it going. I'd leave it up to you guys to make the good decision. You're there, you know.
Is that okay for the motion?
Yes, correct.
Okay, it's been moved and seconded that we reopen the bus service, the transportation, whatever you officially call it, local transportation. Further discussion?
Does that have to go to the board at all?
Not this. It doesn't involve money, so we can do it.
Will they travel even if there's, say, there's only 1 or 2, the bus will still go?
How did we do that in the past, Tammy?
I think, trying to remember, it's been a while.
We'll have to look at what our rules were.
Yeah,
We can't,
because
it's been a
then,
year, we can't remember.
I think we have, it's supposed to be 5 or more on the bus.
Yeah, I think we would probably reduce that to
And I know
4.
Dean even took like 3 to Black River there for a while. He continued to do it because that was.
I think we would start out with lower numbers, just because people aren't used to taking it. We'll have to do lower numbers at first to kind of get people back to being served. If we have to look at having a minimum expectation, we'd probably bring that back to you this fall. Again, when we start up again, we're not going to have people streaming to ride the bus, I don't suspect. So we don't want to not run the bus either because of that.
Any other discussion?
The bus trips usually go to Eau Claire and La Crosse, correct?
Winona and Black River as well.
Oh, okay.
When did they start Winona? I did not know they went to
Oh,
Winona.
a couple years ago.
I'm not up with things, I guess.
It's a rotating schedule. On this day of the week, you go to La Crosse, on this day you go to Eau Claire, this day you go to Winona,
Okay.
Black River.
Many
I don't-
times we had waiting lists for the bus.
Oh, I bet.
So if we got,
If we were able to put together this information, we could put it in the newsletter
So we're
next
thinking
week
maybe
that goes
starting,
out?
yeah, we'd be
Okay.
thinking starting May 1st, I think, is where we're looking at, and so that could go into the new newsletter.
Okay, because, yeah, the next newsletter will come out the beginning of May.
Yep, we can do that too.
Okay,
Yeah, we'll do other outreach.
okay.
The only question that I have remaining for you then, a couple questions. One is, of the existing congregate meal sites, Rainbow, Pine Creek, Boondocks, what are your thoughts on resuming them before we get bids back from the other facilities versus, or do you want them all to start at the same time? And then other programs like the memory cafes, resuming those in person in May or June. We'd like some
We-
guidance on that as well.
We still need to vote on the,
Oh,
on
I'm
the
sorry.
motion.
Get
but
ahead of you.
That's all right, that's a good reminder for what we're thinking ahead. So, call the question, all in favor of the motion to begin the transportation again, say aye.
Aye.
Opposed, nay. Motion carries. Okay, now,
Okay, so thoughts on when you would be comfortable or any direction on starting the memory cafes again? We are short a dementia care specialist, so we probably wouldn't start those till we fill the position, but that could be in a month or a month and a half from now, so that'll be before we meet again. And then the other question is the existing congregate meal sites, Rainbow, Pine Creek, and Boondocks. Do you have any thoughts on them resuming in person before we get the bids back?
Well, haven't they already been approved?
Those contracts have been approved. They
Right.
did submit when the bids originally went
Right.
out. So they are approved already.
Okay, I think that they could resume. As far as the memory cafe, I sort of leave it up to you to make those decisions about what's best and what you can do without the dementia care specialist. I mean, it's hard for me to say, okay, you open that cafe May 1st. You may not have staff to do it. So I would prefer leaving that decision to the ADRC director and her staff and what's best for them and what works for them and what's best for people being served.
Thank you.
I appreciate that. Yeah, that seems like a good plan because it does not sound, like my understanding of it, it really, it is not currently established. I think because of COVID
Right.
and due to, I think just technology has been hard. There's not a active, there's no current active participants in that.
Right. So
yeah, I'd like to
I
take.
leave it up to you to develop that program and then start it when you feel comfortable.
Wonderful. Sounds
I
good.
see a number of people
That's
shaking
my
their head,
opinion.
yes, yeah, that's Jeannie's opinion, but how does the rest of you feel, like, okay, yes?
I like going to the Rainbow on every Friday because it's something to go and something to looking forward to.
So,
Yep.
yeah, we'll have to see how we start that out. We'll be opening it up. I don't know, again, about when the vehicles, the local transportation, how we're gonna, if we'll do that every Friday like we did before or not, or when we'll start that. But I appreciate your input on that. It's something we will get moving, but it might not be May 1st. Thank you.
I hope in the future.
Yes.
It may also be up a little bit to the restaurant itself. I know a
Right.
lot of them are serving openly, but if they want to open it up to the senior meals, I think that, we are apparently recommending that, but it's a good thing.
So for the existing congregate meal sites, we'll take some recommendations out of this document on how we proceed. We'll be talking with those facilities to see what their numbers are, what their thoughts are. At this point, we don't have a date to tell you, but we will get the word out and put it in the newsletter and as soon as we can. I don't know if we'll make this deadline, but we'll be working on that. So I really appreciate this direction. It's been a tough decision. It's been an easier decision once, of course, we got the numbers that almost 90% of our seniors have been vaccinated. That makes a decision a whole lot easier. So I appreciate your help on this.
Next item is transportation software.
So we deliver on a regular year about 20,000 rides for people, volunteer rides, bus rides, rides for the local transportation program with the vans. And we do that all by hand on spreadsheets. And so last night, the Human Services Board made a motion to use up to about 20,000, a little over $20,000 of, we have some funding in a transportation reserve account. And so Melissa and I will be talking to the state to get permission to use that reserve account to buy a software that will track all this. We can put in, we'll have all our riders in there, so, and all of our drivers in there and our bus routes in there. So if Mary calls up and says, I want to ride to Black River Falls because I want to go to Walmart there or whatever, then we can just say, well, Mary, this is the day the bus goes. We've got all Mary's information because we have to provide detailed reports to the state of all of our riders and how many riders and what their ages were and these are all, it's not round trips. These are one-way trips. We have to track all the one-way trips. So we just want to let you know that we did get approval from the committee last night. We are working with IT to make sure that that matches all of our IT requirements and it matches all of our HIPAA requirements because people's names and addresses will be in there. So we want to keep that protected and confidential. But we would be looking to move forward with that software. We don't need a motion from this group, but we did want to let you know that that's a pretty big purchase. We also did, out of that same fund, because we had about $90,000 in that fund, we also purchased a vehicle for about a little less than $40,000. We are replacing a van that has over 100,000 miles on it. So we were able to use those resources for those things. And so it's been nice to have those reserve accounts. We don't have to go to levy. We don't have to dip into our operating costs. We have these accounts set aside with that money of unspent money from previous years. So that's all that I have.
I have a question. Can that be requested for COVID reimbursement, or has that timeline come and gone? You know, because now that we're starting again, you know.
That's an excellent idea. I should have thought of that.
That's a good idea. I never thought of that.
Well, I'm the one coordinating all this FEMA money for the county and never even thought of that. Thank you. Brilliant. We will explore that option. And then if we can, the FEMA money for COVID is the county can draw down, FEMA usually pays about 87.5% of a cost. Through September, we can get 100% of cost. So these nice new microphones, if you were in here about a year ago, you'd about want to scream how difficult the microphone system was. These microphones work beautifully. We were able to buy that with COVID funding through FEMA because we have to use these microphones. We have to have a reliable microphone system so that we can broadcast our meetings to the public. The cameras in the ceilings, you don't see those big cameras in the room like there used to be. These cameras, and as you've watched on here when Melissa talks, all of a sudden you just see Melissa up there. They can just zoom in on her. Those are so, and I guess now you see us up there. And see there when I'm looking at Melissa, hey, they're watching and listening to us. Thank you, TV studio. You guys do awesome. But we were able to purchase these items, and they were obviously very costly items, but we were able to use FEMA money to help pay for that at no cost to the taxpayers, the levy here in Trempealeau County. So that's been really nice. I will explore getting that software because that would help us be able to do this remotely. So that's a genius idea. Thank you.
I mean, maybe it's, you know, after the fact because it's not dealing with COVID, but it's still, you need to track who is there, you know, so if you had an outbreak,
I would
at least
argue,
you have.
yeah, I would argue we need that because, again, the reason you can get things for COVID is so that you can provide public information to the public without them coming in your building. That's what all this is about. You can use COVID money to protect staff, like there was some remodeling done to, in some areas, to change where you greet customers. You've seen in a lot of offices, the treasurer's office, the county clerk's office, that plexiglass that went up. We can use COVID for that. Masks at the front door, we've been able to use it for that. But you can also use it for telework, so for staff to be able to work remotely, so you don't have everybody here germing everybody up. And so I would argue that we would need it so staff could do the scheduling remotely. So that's, I appreciate that. That's a great idea.
Does all
Maybe you-
this,
Oh, I'm sorry.
does all this have to do with, say I couldn't make the meeting, but I can do it online? And that has to do with the same thing you're talking about?
Yes, that's what the software's been able, so we can make it so that people can attend meetings. I know Jeannie attended a lot of meetings last winter remotely because she wanted to stay safe and stay home. She has a responsibility to and Beth too, as a board member, to be at the meetings, to participate in the meetings. And so they were able to do that without physically being in this building. They could vote, they could participate, they could add comments. And so that's, yes, that's part of, we use that COVID money for that as well.
We all got laptops with COVID money so that we could attend at home.
Who got laptops?
The county board members did, but if you want to attend meetings remotely, we do have iPads that you can check out from the ADRC. So if you want to look at that option, you certainly can give Tammy or Melissa a call and they can help you set that up. We were able to purchase about 8 or a dozen iPads for seniors to be able to use remotely, to be able to connect to services.
As long as we're talking about FEMA dollars, maybe you could look at that maybe we could use that funding to do something in the buses with plexiglass to keep people safer.
We have looked at that, adding the plexiglass, for those of you who've been on the bus, and I know some of you are, we talked to Chris, who's a transportation coordinator, because the bus is small, adding that, it just kind of makes it harder
Okay.
to maneuver in the
All
bus.
right.
So we've looked at that option. I actually thought of the idea, and they were like, no, that's not going to work, Deb.
Okay. Alrighty, I'm fine then.
I also had one of the meetings, and everything came through very clear for me, but I can't figure out how to set it up myself. Just for luck, my granddaughter came and guided me through it. But that was very nice, and, I thought, I'm not gonna hear a thing, but I did, I heard everything.
Good, I'm glad to hear that worked. And again, that's what we're trying to make it available so that people can participate and not have to be here. And again, the funds, hopefully, fingers crossed, knock on wood, our numbers are down and they will stay down, and we won't have a situation like Michigan. But we also can use those funds to think about, should we have another pandemic like this, what are the things we need to have in place? For example, we have a couple offices upstairs where if you go in to apply for a job, you walk right into that person's office. Could we set it up where it's more of a window and that person's office is more protected? So we're still looking at some remodeling options here as well.
And actually, hooking onto a meeting
me how to do
remotely
the
has
mileage.
become very easy with Zoom. You don't need to download Zoom to your computer. You just click on the link and it's there.
I agree. It's way easier than WebEx.
WebEx is worthless and we should never ever use it again. So the Zoom is like a miracle for.
So we'll put in a request for the next meeting of the
It is on
ADRC
Zoom.
would be on Zoom.
What did you say is worthless?
WebEx is worthless.
And
This meeting was on Zoom. The link is for Zoom.
No, this
It's
was
WebEx.
WebEx.
Oh,
For
it
me,
says
it
Zoom
was.
meeting on,
Oh.
okay, so yeah, then all the meetings in the future, Melissa, should be on Zoom.
We'll make the request to
I
IT. It's up
totally
to them
agree.
to decide.
Totally.
Well, we do Zoom for a lot of other meetings, so we have a Zoom contract in the county.
Yep.
You just need to get the link.
We'll ask IT what they would like, so.
Any other genius ideas? Save the county lots of money.
It does, it saved, my transportation budget was way down because I did not come to in-person meetings.
Yep, for sure. Okay, next is public comments. Anything that people are experiencing. I know quite often at these meetings, some people would bring up all these scam phone calls and that kind of thing that are happening out there, and lots of training on scams that seem to be happening now through AARP and many other organizations, and so.
On TV, they talk about scams and about the shots and scamming about the shots and stuff like that. So you have to really be careful.
They now have one that's come out, I've had several calls on it, for this money that we got, that if
The
you
stimulus?
wanted it placed, or make sure, and they would, handle it for you. Of course, I listened once, and then now I just hang up, but I get a lot of scam calls.
One thing I found transporting, is there any way, like in Blair, that Silfest apartments, they don't have any way to open the door by pushing this, and those poor people have to get their wheelchair and open the door and then quick get in,
Oh.
or a walker.
Where's
Yeah.
this at?
And that Silfest apartments in Blair, I think it's connected with Grandview.
Aren't there ADA rules about doors
I don't
and
know.
OSHA rules?
We will check into that. If it's connected with Grandview, we'll connect with them and see.
Yeah,
once-
check that out,
okay.
because I know OSHA has, if the door is too heavy, because when I worked in Eau Claire County, we had to adjust our door periodically, because OSHA would come in and check it, and it was too heavy to pull, so.
I think we have paid for some placements there, so I think we could have a conversation with them about them. Thank you.
Other areas of concern or informationally? Mary at home?
Strum when I left, in case you're interested.
We'll all drive up
The only-
there as soon as possible.
The only comment I would have is being new, I don't know what you do in reaching out to the communities, but like just providing like blood pressure checks once a month to various places and communities, and then providing people with information of other services that are offered that they might not be familiar with. I don't know if you do that kind of thing, but I think it would be kind of a nice service if people think it would be used.
We can add that to a future agenda, Mary. Thank you.
That's a good idea.
I would think the health department maybe is,
I think that volume could be a little bit louder.
yeah. She was asking about whether or not blood pressure checks
Oh.
in communities, free blood pressure checks once a month or every other week or whatever. So we'll talk
With the
about it at
purpose
another
of
meeting.
providing information about ADRC, other, as a conduit to providing them with more information about ADRC.
So use those events to get the word out about the ADRC. Yeah, I think that's going to be a big conversation. Your next meeting, you're going to talk a lot about the aging plan, but you'll also be doing, I think we'll be seeking some input from you on, now that we're kind of getting back in business, how do we get the word out? How do we create awareness in the community? So that's what we'll be asking for at the next meeting.
It's been a while since we had a whole year of insanity. I can't even remember what it was called. There was like a one-day workshop or conference or aging fair. Do you remember?
That's not clicking for me.
It would.
Oh, that we did? Yeah, that
Yes.
was related to the Elder Abuse Awareness Month, and we had a speaker come and
Right,
talk
right.
about dementia
When
services.
is Elder Abuse Month? I'm sorry, I should know this.
I believe it's in June. June, I believe it's in June.
Because that was such a really great thing. I think we might want to consider doing something like that every other year, or to engage people to get them, out, maybe.
I think when we get our dementia care specialist on board, and obviously this is probably not the year to start, but starting
Right.
next year is something
Yep.
that we'd want to do, so
Keep that
we'll
on
add
your
that.
agenda, Melissa, because that was very well attended, and it was excellent.
Where was it? Just so I
I
have
believe it
the-
was at the high school, in the
Whitehall High
lot,
School.
in
In
that
Whitehall,
whole
okay.
front area. It was in the
Yeah, we had,
Whitehall High School.
we had a gal from Eau Claire whose name I can't think of right now.
I think Paula Gibson.
Yeah.
Yes.
She came and she talked about dementia. We had some booths set up in the hallway, things like that.
That was really excellent.
We'll add that to a future agenda.
Yeah, she's very good.
Okay. So Mary, have you seen the ADRC newsletter yet? Have you found any in the community?
I have seen it only because Beth provided it to me.
Oh,
Okay.
I think we can always use suggestions on how to get them out. Tammy, where do we distribute those? Just off the top of your head? It's not going to be an extensive list, but
The pharmacies.
talk closer to your microphone.
We do it to the pharmacies. When COVID came, I took them down there and had them use them as like bag stuffers. Because that works really well. People look at what's in there. The clinics,
Home delivered meals?
all the home delivered meals. Dean takes them. He takes them on his local transportation, hands them out to people also. We mail them out. We used to mail out to some churches, but then a lot of churches were closed or doing virtual. So.
Grocery store has them. I've seen them at Robbie's.
Yep, Robbie's has them. Chiropractic offices, but a lot of them are limited. They put one out for safety. So things have changed, but we still got to get it out there. Sweet Temptations, because Scott calls and tells me we're out. Stockman's Farm Supply in Osseo is huge.
Where I live, they have it in
Yeah, and the libraries. We get into all the libraries also. So we get it out to variety, not as big as we used to, but hopefully we can get that to change.
All right, well, thank you, everyone. I'm always confused. At every meeting I run, we go through a motion to adjourn, but then at
we're
one
gonna
of these, I was told that we didn't have to, so.
Do you want to talk about the next meeting if they want to change?
Oh, sure, yep. Yeah, the next meeting is June 8th, and the time is set at 10, but do we want to go a little later?
We can move it to 11 if that would be better for all of you.
10 works.
That would be
10:30?
better for me. But
How about 10:30?
Split the
Compromise.
difference and make it 10:30, we can do that.
That would be good for Beth and I, because we have a meeting at 8:30 prior to this one.
No, because we meet on the first Tuesday.
Oh.
And this is now the second.
Oh, that's right,
Tuesday, so
okay.
there's no conflict.
That's right, okay.
10:30? That
Well,
sounds
also,
good.
we also are looking for volunteers. One of the things we have to have is a nutrition committee. And so how many people do we have on that? Tammy, do you remember? I had,
Thought there used to be 5, but we're just down to 2.
hang on a second. Sorry about that. I should have that in front of me here. Ah,
Those two gals that were from down by, down past Galesville down in there.
One of them passed away.
Which one?
Virginia passed away.
Oh, my goodness.
Yeah, the lady who always brought up the conversation about the scams, she's passed away just this winter. So that was a terrible loss because she was very active in this group.
She always brought newspaper articles. It was really sad.
Yeah.
So the nutrition council we had before was Dora Jean, Shirley Dahl. Shirley's not continuing anymore. She used to ride with Virginia. Virginia, of course, who's passed away. Nancy was on that. And then Cheryl Padula, who's, I'm not familiar with that name. Oh, okay. So looks like we would need, if Nancy and Dora would want to continue, we'll need a couple more volunteers for the nutrition committee. They only meet a couple, 3 times a year at the most. So and we always have their meeting right after the ADRC meeting. So if anybody wants to continue, Dora, would you want to continue on that? Yeah. And Nancy, would you continue on that one? Sure. Okay. So we just need 2 more members then. Okay?
There's
And
2.
Ruth has her hand up.
Okay, thank you. Awesome. That, Linda and Ruth. Thank you.
does that start today? We meet today?
Pardon? Nope, we'll have you meet in June, just so you can
Okay.
get that reorganized in June. It was all we could do to get organized for this meeting, so we're not gonna have that.
In June, it's gonna be 10:30 and instead of 10?
Yes, ma'am.
Okay. I got it right.
So again, that question of adjourning, is it something with You just don't need to?
You can just, what I've done is, we're at the end of the agenda. We can't discuss anything else. Yeah, just with the consensus of the committee, we adjourn at 11:25 or whatever. And you don't need a motion. Some people still require a motion, but in my training, you don't. You could, we're done.
Hey, Mary, we
Okay.
can see your face.
Yep,
It's nice to
there she
meet
is.
you.
There's Mary.
Yes, I decided to become virtual more fully.
Thank you.
It's good to meet you.
Okay, so we
Nice
will
to
talk.
meet you.
We'll talk in June at 10:30, so appreciate all your help. Again, if you ever in the meantime have questions, you can certainly give Tammy or Melissa a call. You can call me if you're really desperate, but those will be more helpful.
Thanks, everybody.
It was nice